I'm very interested in what seems like at the highest level, almost perverse incentives for payers and providers. Providers, of course, want to get paid more, and payers, or at least it would seem from the outside, want to pay less. So their incentives are almost the polar opposite of each other, and I may be wrong in categorizing that in such simplistic terms. But my
Yes.
question is, how do payers and providers collaborate, communicate, and compete when, at least from my understanding, they have almost opposite incentives?
It's a very fair base framework that you lay out. I think, qualifier, of course, is that, on both sides of the fence, if you will, there's always going to be, a vast majority of providers in our experience are extremely honest. And I'll actually get into that. We did all these surveys early on with DocVocate, and compensation actually isn't the one, two, or three in the list of complaints for providers, believe it or not. So we'll walk into that on that side. But of course, there's some that are, and some that do overbill. There's cases out there that need to be regulated. On the payer side, same thing. There's folks that are more profit driven, folks that are more community driven. Of course, you just got so much on that landscape too. But you're correct in that in this ecosystem from the beginning to now, they are sort of it has been a zero sum game of lobbing kind of grenades over the fence of like, here's our claim, now pay it. So, no, we're not. And then I think everyone in the system agrees that's how it's been by and large. And, look, but like ultimately, I think at this day, and if we fast forward to 2022, I think there are many payers that are trying to say, hey, let's get more coverage for people. But we have, what I said earlier, we have to do it within cost. Like we can't, as an insurance company, we can't just generate 3 times the premiums from our folks and then pay everyone and just, right? And then from the providers are saying, hey, look, you can even pay us the same. In some cases, you can pay us a little less. Their biggest complaint is the administrative nightmare, actually, believe it or not. On the provider side, in our country, there's physician burnout. People don't want to go to med school. The graduate rates are lower. But we've had a nurse shortage forever, and the pandemic has made that worse, right? So think about it. I mean, like when we were younger, Chris, like going to medical school was where it's at. It was like there's so many applicants we'll take in now. Like the applicant numbers have dropped, the quality of the applicants have dropped. Everything is, struggling because people don't necessarily want the life of going until you're 30, racking up a bunch of debt, working really hard, coming out, getting paid less, but then spending 40% of your time on administrative stuff when you weren't trained. It's just, and being sort of controlled by the system. And actually, that's where we got passionate about the provider side of things.
Okay.
The payers are large corporations by and large. They take care of themselves. But naturally, corporations be more impersonal and profit driven. On the provider side, they're individuals, and they have lives. They're worried about the quality of life, and they don't have the capacity to deal with the complexities. And so, I think that gives you a little bit of the lay of the land. And, the reason with DocVocate's position on the side of the providers, they don't have resources. They don't have the resources that the payers do. So maybe it's more like a grenade and then like a larger bomb is being tossed over the fence. So we're trying to level that playing field in our base philosophy. But and I think you were kind of asking about fee for service, and I could talk about payment models, but I'll pass it back to you to make sure that I'm heading in the right direction.